Welcome to The Explainer. Today, we are diving deep into the actual blueprint of our medical system to decode the architecture and economic logic of for-profit healthcare. It's honestly a fascinating structural analysis, and it might just challenge everything you thought you knew about the business of saving lives. Let's get right into it.
Okay, so right off the bat, we run into the ultimate tension in modern medicine. It's a question that sits right at the center of the entire healthcare debate. Is it actually possible to maximize shareholder wealth while simultaneously saving lives? I mean, can a system that's explicitly engineered for return on investment actually deliver on the fundamental promise of human health?
Here is how we're going to break this all down today. First, we'll look at the rise of for-profit care. Then we'll explore the legal and economic architecture, figure out who really benefits, examine some real-world successes and challenges, and finally, look at the future of these health systems.
Let's start with part one. The rise of for-profit care.
So if we look back to the pre-1950s, hospitals were, they were largely charitable safety nets. The profit motive basically didn't exist. But then comes 1965 with the introduction of Medicare, and wow, that changed absolutely everything. Suddenly you had this massive, guaranteed revenue stream, and you know what happens when there's predictable revenue, right? It sparked a huge corporate hospital boom in the 80s and 90s as private capital just rushed into the space.
When you look at the historical data on community hospital beds by ownership type, it perfectly illustrates this sudden, dramatic shift. You can pinpoint the exact moment private capital entered the arena, completely transforming an industry that, up until then, relied almost entirely on community donations and local government funding.
Moving right along to part two, the legal and economic architecture.
Okay, so here is the absolute core difference, and it's a stark legal contrast. Not-for-profits are legally bound to a community mission. Any surplus they make has to be reinvested. But for-profits, their statutory mandate, their whole reason for existing, is to generate capital return and investor value. It is literally a completely different operational blueprint. Now, you might be wondering, why do for-profits even exist in the space to begin with? Well, it all comes down to a few structural catalysts. First, hospitals require immense capital. I mean, think about those multi-million-dollar MRI machines. Combine that desperate need for cash with insurance risk pooling, where patients aren't usually paying the massive direct costs out of pocket, and you have created the perfect environment for corporate revenue maximization. Which brings us to part three, the big question: who actually benefits? Patients or shareholders? We hear this public assumption all the time, right? Does introducing a profit motive actually lead to worse care? Does it lead to higher mortality rates for patients? Essentially, if you prioritize the bottom line, does that automatically mean you're cutting corners on human lives? Well, the hard data from the National Institutes of Health is actually pretty surprising. When for-profit hospitals take over, their financial margins jump dramatically. We're talking an improvement of 2.2% compared to just 0.4% for the control hospitals. But, and this is the crucial part, look at the mortality rate. It remains statistically unchanged. So the profit motive drove up the margins, sure, but the data explicitly shows it did not come at the cost of patient lives. But hold on, because here is the catch. While clinical care stays steady, charity care plummets. We are talking about a massive drop of anywhere from $400,000 to $800,000 per hospital after they convert to for-profit status. What does that mean in the real world? It means the immediate financial safety net for the uninsured folks in your local community measurably and significantly shrinks.
Let's transition to part four, real-world successes and challenges.
To see how this actually plays out, take Wesley Medical Center in Wichita. When the for-profit chain Columbia/HCA acquired it, they didn't just sit back. They aggressively optimized their revenues by legally exploiting Medicare loopholes. For example, instead of accepting one flat payment for acute care and rehab combined, they separated those services. That brilliant, albeit aggressive move generated two distinct revenue streams and totally shifted the local market dynamics.
But honestly, the most profound challenge here is something called the contagion effect. Research from the National Bureau of Economic Research reveals that local not-for-profits eventually learn to copy these exact same aggressive billing behaviors. They feel they have to just to survive the competition. So the mere presence of a for-profit literally alters the financial DNA of the entire surrounding healthcare ecosystem. It spreads like a virus.
Finally, let's wrap up with part five, the future of health systems. Moving forward, keeping this complex, intertwined system balanced is going to require some serious vigilance. Regulators absolutely have to step up.
They need to closely monitor things like billing upcoding, rigorously enforce the actual community standards that justify those not-for-profit tax exemptions in the first place, and drastically increase due diligence by state attorneys general when hospitals try to convert.
So, I want to leave you with this somewhat provocative thought. If the ultimate survival tactic for a not-for-profit hospital is to simply mimic the aggressive financial behavior of a for-profit, what eventually happens to our community safety net? Something to really think about. Thanks for joining me for this explainer. Keep questioning the structures around you, and I'll catch you next time.